hope you are doing well wherever you find yourself. So we are group 15 and we are presenting on personality disorder and our adopted disorder as OCD. That is also known as obsessive compulsive disorder. So when you talk about personality, what is it all about? Personality actually refers to a pattern of thinking, the way one feels and how one behaves, and the behavior is what's consistent over a period of time. So in other sense, personality actually refers to the character of a person. So the personality forms the character of the person. And before the character can be formed, it actually talks about the traits. Okay, so as the combination of many personality traits that forms the character of the person. And also there are some interactions between the psychological and then the physical aspects of what? The system. Okay. So and talking about the disorder, personality disorder actually talks about the malfunctioning in the normal behavior of the person. So in other sense, when the person has the disorder, they find it difficult in changing their ways of thinking and then the pattern of doing things and how they feel and their behavior. Yes, that is what the disorder actually makes one do. And a person with that disorder actually doesn't know how problematic their behavior is. They end up blaming others for not liking them or treating them unfairly. So now we are going to talk about the main topic, that is OCD, obsessive compulsive disorder, and it's also known as what? A mental disorder, which the person who is affected with has what? Obsessive thought. So when we talk about obsessive thought, it's persistent, disturbing preoccupation with an often unreasonable idea or feeling, and then the compulsion is an impulse to perform an act that is irresistibly what? Persistent. So in other sense, they repeat their behavior, and then it's also a mental art, and it becomes kind of ritual. Example, a person with an obsessive thought might be that certain numbers or colors are good or bad, and that the person with the compulsion normally takes his or her bath after visiting the washroom, or they continuously wash their hands with the fear of contaminating germs or getting infected. So people with OCD actually are neat, because some people, they have both the obsession and the compulsion. Okay, and it's a mental illness that is caused repeatedly by doing an unwanted things, and it's both in men and women. So with OCD, you can't say it's only men that experience OCD or it's only women that experience OCD. Though we have a percentage for the genders, but it affects both people. And it's also distressing, and significantly it interferes with people's normal way of doing things. That is with the OCD. And so to be able to identify if someone is having an OCD, you actually see they are very, very, very neat. That is, they are extremely neat. And when they are cleaning things too, they give extra, or they do it to the extreme length. And also, they experience frequent obsessive thoughts and compulsive behavior. They orderly arrange things. Okay, and the women too can contract the OCD, especially when they are pregnant. And with that one, they constantly check, or after giving birth, they constantly check if the baby is still breathing. Like, they have this kind of fear and panic that the baby can't die at any time or vanish at any time. So when the baby is sleeping, they check on them constantly, and they also check if the feeding bottles they use for the child is what? Disinfected. They also are very insecure. So before they leave their place or they go to bed, they check constantly if their windows are locked and then their doors are shut. Okay, so the OCD is actually caused by family histories. It can also be differences in the brain, and then a number of different factors that may play as a part of causing the OCD. Yeah, so it's not any spiritual thing. Like when you're having OCD, they will say you've offended the gods, that's why you are having OCD or something. No, actually, it is based on some reasons. That's when people get OCD.
The characteristics of obsessive compulsive disorder, to start with, fear of contamination by dirt or germs. So such people, they are always afraid that when their hands or their clothes are dirty, they can be contaminated by germs or any other virus. So they always make sure that their hands are clean, they are neat in whatever they do. And fear of safety, they are leaving their doors or windows open. So they always make sure that they close their doors and windows so that no one can come in to steal them. And they also strive for perfection. They also make sure that whatever they are doing is perfect, and no one. People say that what they are doing is perfect, so people always praise them. And they always make sure that they are religious fear. They always make sure that whatever they are doing is moral. They don't want to do anything immoral in the society. So that's the characteristics of obsessive compulsive disorder. So to continue with the ways that we can prevent OCD, research shows that there is no sure way that we can use to prevent OCD, but there are certain things or medication that we can use to treat it, to prevent it from getting worse by a specialist or any medical doctor. So with the medication, you have antidepressant, which is usually used by specialists in treating of OCD, and this one, it is usually used for treating depression. So, however, in usage of this medication, you have to make sure that you do not overdose it or you do not overuse it, because overusing this medication can even worsen your situation. And we have other alternatives that we use in treating of the obsessive compulsive disorder. We have the cognitive behavioral therapy, we have the psychodynamic therapy, and we have surgical procedures. These are the alternatives that are prescribed by specialists in treating of the obsessive compulsive disorder. So with the cognitive behavioral therapy, is seeking for help from a specialist, whereby a specialist gives you procedures to make sure that you are able to overcome this particular disorder. And under the cognitive behavioral therapy, we have another therapy, which is the acceptance and commitment therapy, which shows that you, the individual who is affected by this disorder, you must commit yourself and open yourself to ensure that you are ready to embark on the process or whatever the specialist is telling you to do. And we also have the exposure and response prevention therapy under the cognitive behavioral therapy. This one, the therapist should ensure that he supports you emotionally to overcome your disorder. And you have the psychodynamic therapy, which is another alternative in treating the cognitive, the obsessive compulsive disorder. This one, the therapist ensure that you look through your different life aspects, the patient life aspects, your relationship, your personality features, and your life story and your life events. So, as it is, OCD usually occurs after a particular life event such as childbirth. So, the therapist makes sure that you look through your life events, your past events, what you have done, your actions, your relationship, and other things, to ensure that you are able to overcome this particular disorder. And we also have the surgical procedures, which is as a result of the increase in technologies. So OCD as a mental disorder, with the use of surgical procedures, we are able to prevent OCD. So with the prevention of OCD, we have medication, psychodynamic therapy, we have the cognitive behavioral therapy, and we have the surgical procedures in prevention of OCD.
Okay, so in conclusion, OCD can be found commonly when people are being bullied and then they've been abused or neglected. And it sometimes comes after an important event has occurred. So let's say the person had a family and then the family were killed all of a sudden. That incident brings kind of fear to them, that they fear to exist and do things normally like they used to do previously. So it's better. So when a person identifies that they are going through certain things, or you identify a neighbor going through certain things, it's advisable to tell the neighbor to seek for medical help, because as was said previously, it's not a spiritual thing, and there are healths that are there. Sometimes it's not healed completely, by day, with the training and the assistance of the health practitioners, it is able to calm down, and the person is able to live at least a better life than they used to live with the disorder. And let us also not prevent or avoid people going through certain things. They need love, care, and attention, and to also feel among. Thank you.